Welcome to the Community Health Building. This is the sophomore class posing for a picture. These are the junior students. During grade 9, students learn basic healthcare skills and they earn CPR, first aid, and AED certifications. The freshman book covers the history of healthcare, many different types of healthcare facilities, basic anatomy, and as you can see, the students actually are able to interact with a lot of equipment to learn the material. Here, students can actually visualize x-rays, and that is a tibia fracture. Here is a rod placement in the humerus bone. Students are instructed how to use assistive devices and are able to assist patients with them. Students simulate many wounds and actually do first aid care on each other. The student is performing her CPR skills. All students are trained in the use of an automated external defibrillator. Here is some oxygen equipment, tracheostomy, endotracheal tube, inhalers. This is an infant AMBU. During the 10th grade, students do have opportunities to go out on internships, and they earn 2 more certifications. Students who would like to take a college-level course as advanced placement may do so sophomore year in psychology. All students will actually take the introduction to psychology. Students are introduced further in depth into medical terminology. They earn their paid feeder nutrition assistant certification, and they actually will learn many skills for working in a medical office. Here we have an exam table set up like a doctor's office. This little tablet, I can set Hal, who is a 5-year-old simulated mannequin, to have vital signs, which the students can then take his blood pressure, and we can see if they did obtain the correct measurements. We practice hand washing and many other infectious control skills. During the 11th grade, that particular grade focuses on nursing assisting. They will be certified as a nursing assistant their junior year. Students practice in the laboratories. This particular laboratory has 7 beds set up as they would be in a hospital. This is a standing lift. Students practice with each other. Then the students go out into the clinicals and actually perform their skills. The student is assisting a resident with feeding. More simulated activities. With the mannequins, the students can actually do denture care, hair care, and all of the nursing assisting skills. This particular mannequin is also simulated. Students are able to take blood pressures on him as well. Students are able to take heights and practice taking weights. This happens to be a seated scale. And grade 12 students certainly can be going out on co-op, working, rather than coming to shop. But if they choose to stay in shop, there are many certifications. One of them is they are trained to be EKG technicians. They also earn their certification working with residents with dementia. First responder certification. We work with a lot of the equipment that is found on ambulances. These are many of the internship and clinical sites that we have used over the past few years. Internships in grade 10 work in the activities department. Grade 11 are in long-term care settings. And grade 12 is either co-op, and then there are a few more internship experiences. There are many different career pathways. Here are a few for direct entry into the workforce, post-secondary training, or going on to a university. Thank you for touring Community Health.